Smartphones are the magic wands of our time. Communication is instantaneous and optimized for our needs. Text, pictures, sound, or video, everyone is connected all the time. Now imagine living your pandemic day without your smartphone. That is the reality for in-hospital healthcare workers. Patients have smartphones, but they can't be used. Hospital technology has not entered the smartphone age. This video will demonstrate how to maintain privacy and safely put smartphone tools into the hands of healthcare workers using proven technology for very little money to benefit patients and healthcare workers. Royal Columbian Hospital has been pioneering the use of these tools for combined virtual and in-person care since the start of the COVID-19 pandemic, and now is the time for the healthcare system to capitalize on the success. This is not mission impossible. Within the first weeks of the pandemic, Royal Columbian Hospital's emergency room, ICU, and COVID ward were up and running with smartphones and tablets that facilitated communication between healthcare workers, patients, and families. Careful work in the months that followed evolved the Band-Aid solution into a secure, scalable virtual care platform. It puts frontline healthcare workers in charge of workflow and teaches patients about combined virtual and physical care while they are using it. But how is this possible? Healthcare technology is usually built slowly from the ground up over months and years. Everything must be auditable, stored, measurable, and when you're dealing with personal health information, that process takes time. The outside-the-box thinking goes like this. Frontline healthcare workers and patients sick with COVID-19 don't want documentation of their private healthcare conversations. The existing medical record systems already provide that functionality. They need secure, private virtual communication tools that function like the smartphones they already know how to use. They want to be able to whisper in each other's ears, but do it using video calls, texts, pictures, and voice memos. And once the message is received, it should be deleted, not stored forevermore. Signal is the open source app that is trusted around the world. It was created by the inventor of WhatsApp and is maintained by a non-profit organization dedicated to free, secure, private internet communication for anyone. It is used by freedom fighters, Google executives, and everyday people. Even with search warrants, governments and law enforcement are unable to extract data from the system. It is optimized for privacy. When you give healthcare workers facing a crisis easy-to-use, secure virtual communication tools, great things happen. In the emergency department, these tools are already being used for resuscitation, body camera communication, communicating with patients locked in isolation rooms, virtual family visits, a virtual emergency department waiting room, preparing for the possibility of lockdown nurses and doctors having to work from home, and using the devices to educate patients, get feedback, and keep them entertained. As this video has demonstrated, healthcare workers and patients need these tools now to help fight COVID-19. The tools are safe, they maintain privacy, they're inexpensive, and using the patient's own device makes them rapidly scalable, hospital-wide, health authority-wide, and province-wide as needed. A year from now, traditional vendors like Microsoft will hopefully deliver these solutions turnkey for use inside the traditional IT infrastructure. And when that happens, today's investment in hardware and workflow will not be lost. These devices are ready to deliver post-pandemic value, as well as help us right now. In the quest for new solutions to modern and responsive healthcare, this is an opportunity to take a clear step forward. Please help us fight.